Hello, everyone, and welcome to this recorded presentation of Health Literacy 101, an introduction to the field. My name is Michael Valere. I'm the president and CEO of the Institute for Healthcare Advancement. We are going to talk about health literacy today, so let's go ahead and jump right in. A few things that we're going to talk about and what you'll learn about today. Health literacy, obviously, is our topic. We're going to provide some definitions, talk about what are the components that make up health literacy, and show you some examples of how this works. We're also going to look at some data from national surveys. These data are a little old, but I think they still paint an accurate picture of the prevalence of limited literacy and limited health literacy. And there's also a data source that I'll tell you about, that you can get a little more updated data on that. We're also going to take a look at a video clip that was produced by the American Medical Association Foundation called Health Literacy and Patient Safety: Help Your Patients Understand. This is an older video, but I have to tell you, it is a very powerful video that really shows how the concept of limited literacy weighs on, and is an issue that people have to deal with who have limited literacy, so that you can get a little empathy and a little understanding as to how that works in the real world. And we're going to look at some health literacy statistics, prevalence, and cost, and talk a little bit about whether we should screen for health literacy. So here we go. So first of all, just some definitions. People always say, well, what's the difference between literacy and health literacy? And there are differences. So literacy is really using printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. It's essentially your ability to read and write and be able to see the cues and all the information that are presented to you as an individual, to be able, as I say, to function in society. Health literacy is really about that space, that interaction between the skills of the public and the demands and expectations of the health sector. We, as the healthcare system, what are we asking people to do, and what is their ability to do those things? So whether this is get screenings, manage a chronic illness, take a prescription medication, make their doctor's appointment, exercise, do lifestyle changes, make a decision about surgery, all of those sorts of things, those all come at an interaction, at kind of a collision point between us, the healthcare system, and the people that we serve. And so when those things are not matched, this is an issue that is within the realm of health literacy. So for our next slide, health literacy, there's a couple of definitions, and this got revamped recently with Healthy People 2030, and they broke this into two separate definitions. So there's a personal health literacy definition and an organizational health literacy definition. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So it's everybody's ability. It's each individual's how well can they respond to those demands that we as the healthcare system put on them. Then there's the organizational health literacy, which you could also maybe call systemic health literacy, the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Now, that's that phrase there, equitably enable individuals. That's really the kind of the key part. Remember, we are the healthcare system. We're the experts here. We're the ones with the knowledge. We're the ones who work in the space all of the time. Patients and people coming into the healthcare system, they spend a fraction of their lives interacting with healthcare and the healthcare system. So the language, the jargon, the way that we are asking them to navigate the system, how they can understand how to take care of themselves, understanding how to take their medications, how to manage their chronic illness. All of these things are very, very complex topics and concepts. And quite often, we as the healthcare system really don't do a great job in terms of explaining how these things work in terms that people can really understand and act upon in an effective fashion. So this is what we're going to talk a little bit about today, is that how we can kind of do a better job at that. Oops, I'm sorry. So health literacy components, what are some of the elements of health literacy? Well, really reading and writing. What grade reading level are we writing our materials at? If we're asking people to write something back or communicate with us that way, that's going to be an element. Listening and verbal communication, so that sort of audio or verbal component of the system when the practitioner is in the exam room with the patient, when the educator is talking with the patient, when the insurance agent is talking with the client, when the hospital or the front office staff is talking with the person coming in for the appointment. There's that notion of us listening to what people are saying and being aware of cues that person may be putting out as to whether this is something that's difficult for them. Numeracy, this is another very specific concept. So another name for numeracy is also quantitative literacy. So computation skills, being able to figure out numbers. If I tell you you have to take 2 pills 4 times a day, how do you figure out how many of those pills to take and at what time? If you have a child who is sick and there's a medication and they give you a dosing chart, you have to be able to look on that chart and find the age of the child or the weight of the child and figure out what that dose is, follow some x-axis and y-axis numbers to come up with a number. Then there's this whole notion of risk, interpreting or evaluating risk. And that's a very, very complex topic. There is the kind of the classic example of risk is somebody says, here's a pill and it works in 1% of the population and it's only $5. But this other pill is twice as good and it works twice as well, but they cost $100 each. Well, if you look at that, you're talking about a pill that's going to work for 1% versus the other one working for 2%. That's not a big increase. It is double, but it's still a minuscule increase. And the cost of that has gone up by 20-fold. So be asking people to evaluate risk and interpreting what these things mean. What is your likelihood of getting cancer if you make a lifestyle change versus if you don't make a lifestyle change? These are things that we need to be very clear and help people on because these are very abstract concepts. And people, as we are going to find out, don't have really great numeracy skills here in the United States. And then self-efficacy, which is the ability for you to take care of yourself, take care of others, manage a chronic disease, all of those sorts of things. A few other considerations to take into consideration, or a few other things take into consideration. Culture and belief systems. What you believe may not be what somebody else believes. And their idea of health and wellness and what causes certain things could be based upon their belief system. There are many religions that believe physical ailments stem from a place of spirituality. Others believe that the earth and the air around us are all factors that cause illness or bring about wellness. In Western medicine, we're really about systems and diagnoses and pills and what is wrong and fix what is wrong. In other healthcare systems, these could be based upon energy. They could be based more upon philosophy. So it's not that we're saying that you have to adhere to somebody else's belief system, but it's important that you understand that and that you understand that there are differences and work to try to find that common ground. There's a mismatch between what we as providers ask of patients and patients' skill level. So these are things that we need to be very aware of. If a patient comes in and they are pre-diabetic and we as the provider say you need to lose 40 pounds, come back in a month, that's kind of unrealistic because how do they do that? What do they need to do? There are lifestyle changes there are diets, there are family members that live with them, there are economic concerns in terms of being able to buy certain foods and make choices, being able to cook. People may not have access to a market, they may not have access to a stove. So there's a lot of things that we really need to just be aware of when we think about the demands that we are putting on individuals. We talked a little bit about the mismatch of reading levels and materials. Some studies have shown that most reading materials that we give to patients are written at a 12th grade reading level or higher. And frankly, half of the population is reading at or below an 8th grade reading level. So there's a mismatch there. And when we just hand somebody a piece of paper or give them a URL to a website and say, here, read this. There's a strong relation between health literacy and health equity that we really need to be very, very aware of. There's also a strong relation to safety and quality. When we talk about health disparities and health equity, we're talking about the ability for people to access information. This is especially true in areas such as access to healthcare. If I don't understand how to get and use and keep a health insurance policy, Medicare, Medicaid, or private health insurance, then that's a big problem. That person's now going to be at great risk because they don't understand how to use that policy. And frankly, the system's at risk because if that person's not using that policy correctly, then that care is the care is not being covered, or it's not being paid for in the most advantageous way. Again, with safety and quality, when we're talking about post-discharge or hospital discharge instructions, how to take medications, if people don't understand how to do these things correctly, that's a huge risk, and that can be a huge liability both for the patient's well-being and for us as well. All right, so here's my buddy who's got a nice little cocktail in front of him. You know what you mean, but does he? The guy says, my doctor said only 1 glass of alcohol a day. I can live with that. So clearly there was not a subsequent discussion on what is meant by 1 glass of alcohol per day. Obviously, this is a little exaggeration, but it really brings up the notion or brings home the point that just because something is clear to you, it really only means that it's clear to you. There are ways for us to test and assess whether the people that we are serving understand what we're saying, and we'll be talking about that a little bit in a little bit. So here's some things. Oops, sorry, I'm going to hit one. Mr. G, 45, a Hispanic immigrant, native Spanish language speaker, has a job health screening. He's told his blood pressure is high. He can't work until it's controlled. He's given a beta blocker, a diuretic, and written instructions to take each, quote, once a day. A week later, he presents at the emergency department. His blood pressure is very low. He's dizzy. The doctors can't figure out what's going on. So one of the Spanish language speaking healthcare team members asks him how many pills he took each day. 22, says Mr. G. In Spanish, the word once means 11. So he was taking 11 beta blockers and 11 diuretics per day. So this begs the question, can poor health literacy kill you? Boy, it sure can. And these are just, this is just one of so many stories that are out there in terms of what can happen. Here's another example of just something to consider. At a teaching hospital, an intern writes in a patient's problem section of the medical chart, speaks no English. The attending physician writes a note back in response, your problem, not his. Just because somebody does not speak our language, that is not a medical problem. That is a barrier. That is a challenge. And guess whose responsibility that is to remove that barrier? That's our responsibility, because we are the healthcare system. So we have strategies in place for this. We have language access services. We have interpreters. We can get bilingual providers. There's a number of different ways that we can make sure that language is not the barrier to somebody being able to access high quality care and be able to get the care that they need to be able to live a full life and to be able to thrive. So I mentioned before that we have a video that we show, and this is from the AMA. It's a little bit old, but again, the stories are absolutely spot on. And I want you just to watch this. The subtitles, take a look at the subtitles. They will tell you who these people are, what they do for a living, and what their grade reading level is. And these people are just sharing their own story. So let's go ahead and give this a watch and a listen.
Missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay? And you're talking to an intelligent doctor like yourselves. And these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
One capsule.
That's right, one capsule.
One capsule. I don't know what this is. Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there, tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Which one is which and what you take them for?
That looks like my medicine that he gave me for the morning. I take that and the little pill that, no, this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me
Okay.
on there and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered. Hypered.
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
Being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
You have panic attacks. Did I do it right? Is this done right? Am I imagining things? Do I go back over and check it again? I've caught mistakes that I made, simple mistakes.
It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
People sooner or later will discover, and that is your most greatest fear. What day is it going to be when somebody discovers you can't read and write?
I would get mad about something and blame them that this is not the right place for me, you're not respecting me, and walk out. And it had nothing to do with that. It was just I need to cover that I couldn't read this. I didn't want them to know that I'm walking out because I can't read.
So you found solutions that
Yes.
sort of make it work,
Make it work.
and hide the
Yes.
real problem,
Yes.
so that others won't notice.
Right.
Doesn't that take a lot of your time?
Yes.
Doesn't it take a lot of effort for
A
you?
lot. Very emotionally. Yep.
It drains you?
Yep.
Okay.
I am married to an engineer now, and this man has some health issues, so we are in the doctor's office from time to time. We will walk out of the doctor's office, and my husband, with all of that left-brained intellect, will say to me, "What did the doctor say? What am I supposed to do? I don't understand."
I'm going to say, well, one of the things that you can do if you have a really bad pain, I mean, where you can't stand on it and it's really getting in your way, is to use what I call, this is my little pain protocol here. It has ibuprofen, which decreases those little cells I was talking to you about, the inflamed part, and your Tylenol that just works on the pain. And the I is for ibuprofen and T is for Tylenol. And this just shows you how to do it over the course of the day. For breakfast, lunch, and dinner, there's an I, so you use ibuprofen.
Right.
Because you have to have something on your stomach.
That's right.
With that one.
Yeah.
Because this one will irritate your stomach.
Yeah.
So in between meals and at bedtime, you use a Tylenol.
Right.
This way you get something every 3 hours. You don't overdose on either one. So it's IT, IT, IT. And if you do that for a couple of days when it's really bad, then you can just go back to your regular regimen. But this usually breaks the pain pretty nicely. So I know you have a lot of friends with arthritis. How would you explain it to them?
Well, for breakfast, I take I. 10 a.m., I take T. Lunch, I take I. 3 p.m., I take T. I at dinner. And T at bedtime. Is that correct,
That's
Doctor?
going to work just fine.
Thank you.
Okay, so
Miss dosage and
before we go on to the statistics here, I just want to say, now we're not in a live lecture here, because normally I would have a discussion with you about the video. I would like you, though, to give that a little bit of thought. And if you watch this video with somebody else, have a little discussion around this. I think I mean, in addition to these stories just being very, very real and kind of heartbreaking in many respects, it's also very eye-opening that sometimes I think we as the healthcare system, we make an assumption that just because we said something, just because we handed out a piece of paper, just because somebody looked at us and nodded their head and said, "Yep, I understand," does not mean that that information got communicated and understood in the way that we had hoped it would. And if you walk away with nothing else from this lecture, just if you understand that that is a very bad assumption for us to make, then we will have achieved a whole bunch there. So let's move along. Let's take a look at some statistics in this area. There were really two major U.S.-based studies of literacy that were done relatively recently, the 1992 National Adult Literacy Survey, and then it was replicated with it was really done quite differently. It was unfortunate because it made it a little tough to compare numbers. But in 2003, the NALL, National Assessment of Adult Literacy, and the NALL added in a health literacy module. There are no further plans by the Department of Education to do another survey, but this website, which you see there, PIAC, which is the Program for the International Assessment of Adult Competencies, you can get some United States specific, or actually any country's specific reports on a little more recent literacy data. So let's take a look at these studies. The literacy levels are essentially 4: below basic, basic, intermediate, and proficient. And from the null, what we find is the percent of the adult population that are in the bottom 2 categories. So we saw it was below basic, basic, intermediate, and proficient. So the results from the null, the amount of people who are in the bottom 2 categories in prose literacy, which is your ability just to read sentences and paragraphs. Prose literacy, 44%, almost half the population fell into the bottom 2 categories. Document literacy, which is your ability to kind of navigate something on a sheet, whether this is a dosing chart or a form, or being able to find a specific piece of information. 34%, about 1 in 3 US adults fall in the bottom 2 categories. And then numeracy or quantitative literacy, which we talked about a little before. More than half of the US adult population falls into the bottom 2 categories in that particular literacy skill set. A few other, now, so that was the literacy findings. So now here are the health literacy findings. 36%, which again is a little more than 1 in 3, have limited health literacy skills, meaning they fall into the bottom 2 categories, the below basic and basic, and you can see the breakdown there. Only 12%, which is about 1 in 10, are considered proficient in health literacy. Let me say that again. Only about 1 in 10 US adults is considered proficient in health literacy. And if you think about the US healthcare system, I think we could probably all agree that the healthcare system is a pretty complex system, and one would really need to have proficiency to be able to navigate it effectively. And right now, only about 1 in 10 are considered proficient. And then about half fell into the intermediate level. So here's another one. This next slide, I want to be very careful about how we deal with this, because the heading says, who has poor health literacy? What we really need to understand is that in each one of these groups, it doesn't mean if you're in the group that you have poor health literacy. It means members of this particular group tend to have a higher incidence of low health literacy. So with that distinction, so you can't just look at our first statistic here. Nearly 60% of those 65 years of age or older fall into the basic or below basic category. Doesn't mean anybody over 65 has poor health literacy. It means that there is a greater likelihood that those who are 65 years of age and older, okay? Those who have health insurance from an employer tend to have higher health literacy, and those on Medicare, Medicaid, or who have no health insurance tend to have lower health literacy. A few other ones based on who we are. Hispanics represent about 19% of the adult population, but disproportionately, they represent about 35% of those in the below basic health literacy category. Similarly, those who are living at or below the poverty level, that's about 12% of the US adult population, but they represent about 43% of those in the below basic health literacy category. And then, lest we think that it's only those who are economically disadvantaged or minorities or anybody else who is not white, about 3 out of 10 white people have basic or below basic health literacy. And then another interesting statistic, those 75% who self-reported that they had poor health, so they were asked, how is your health? 75% of those who said, my health is poor, they fell into the below basic health literacy category. So, all right, why does health literacy matter? It matters for a great many reasons. First of all, those with limited literacy skills tend to report poorer overall health, poorer ability to manage their chronic diseases. They have poorer outcomes. They're less likely to understand their diagnosis. They're less likely to have screening and preventive care. They tend to present in later stages of the disease, and they're more likely to be hospitalized. And when they are discharged, they have a greater likelihood of being rehospitalized, readmitted. So let's take a look at the cost. We're going to start to connect a few dots here. This is an older study that showed about $73 billion was spent unnecessarily due to poor health literacy in this country. A little more recent one showed upwards of 238 billion in unnecessary costs annually due to poor health literacy. And then let's see if we can tie a few of these things together. The cost of chronic disease in this country, one of the statistics, more recent one, about $1.1 trillion is spent on direct treatment of chronic disease. 3.7 trillion, which includes the indirect costs, which is loss of productivity and everything surrounded that. That's about 20% of our gross domestic product. 60% of Americans live with a chronic disease, and 40% of them have 2 or more chronic diseases. 90% of those 65 years of age and older have a chronic disease, and 77% of those have 2 or more. So remember our statistics about those who are 65 years of age and older, and 70% of annual US deaths are attributable to chronic disease. So we can start to tie some of these bits together. The prevalence of chronic disease and the difficulty that and the challenge that it takes for people to understand how to manage that chronic disease, and the cost that is spent because of poor health literacy. And when we look at a group like those 65 years of age and older, they are the ones carrying the greatest burden of managing chronic disease, and yet as a group they tend to have the lowest ability to understand and manage those chronic diseases. So we can see this is one of the main reasons why, one of the big reasons why health literacy really matters. A few more statistics, as we mentioned, about 1 in 2 Americans can't read above an 8th grade level. And most patient education materials are written beyond the ability of the person getting it to understand. These statistics from an AMA study, 26% couldn't understand when their next appointment was when it was written on an appointment card. Almost half of the people couldn't understand the instructions take on an empty stomach, and 60% couldn't understand a consent form. I think that number is remarkably low. I think consent forms are actually written at a much higher level and probably much more difficult for people to understand. A few other statistics, about 430 languages that are spoken or signed in the US, 45 million foreign-born people living in the United States, 68 million Americans, about 20%, speak a language other than English at home. 24 million Americans, or about 8%, have limited English proficiency. And here's the most insidious one of all: 75 to 90% of patients in the 2 lowest reading levels describe themselves as being able to read or write English well or very well. So we really can't rely on people to tell us, hey, I'm not a great reader. Then, of course, there's things like cognitive impairment, which can be brought on by age, disease process, medications. There's visual and hearing impairment, all these barriers to communication. Stress, the statistic is that most forget about 50% of what the healthcare provider told them the minute they walk out that door. And then here are some statistics about shame, which is a powerful motivator around shame and illiteracy. You can see about almost 20% never told anyone that they had literacy problems. So sometimes people will say, oh, well, let's just give them a literacy test. No, that's unnecessary. It's shaming, and it really has no practical purpose. We in the health literacy community recommend what we call universal precautions, which is essentially, let's treat everybody as if they're low literate. So let's be clear. Let's write plainly and effectively. Let's remove the barriers. And then there's actually a study that showed you can ask one question and it has a very good correlation to people's literacy levels, and ask them the question: how confident are you filling out medical forms by yourself? That's kind of a proxy question that can really get to people's their comfort with filling out literacy forms like that. So that's our presentation. Thank you very much. Normally I would take questions right now, but if you have any questions, my email address is there. And if you want to learn more about health literacy, I very strongly recommend you would go to our online portal, our website, healthliteracysolutions.org. There's a ton of material, education, resources, free webinars, recorded conferences. There's an online community of your peers. You can ask questions. There's just a ton of stuff for you to do there. We are always happy to help you and serve you. And thank you very much for your attention. I really appreciate it.